Okay, so here we are with some of the main medications. These two are prescription medications. This one helps cognition and sleep. This one is the medication that really slowed down the progression of dementia in the patient that I'm taking care of. These ones are stool softeners. They deal with constipation. So basically these two things are the same. I bought this from Amazon USA. They're over-the-counter things. And in UK you can buy this. Ease. They're capsules, small capsules. And this one is also a bunch of capsules, a lot of them. You just swallow them whole. What these things do is they will keep water within your intestines to keep the stool soft. So they will retain water within intestines to keep your stool soft. This thing does that same thing. It's also known as Movacol. Over here it's called Lexido. Lexido is cheaper than Movacol. They come in small sachets. It's a white powdery thing. You mix it with water and drink it. No matter how bad your constipation is, if you take 6 of them over certain time limit, it's written in the instructions, it will force stool to come out. So these things are like something you have to take daily. This is a naturally occurring hormone, if I'm not mistaken. So when this is produced in your brain, you become sleepy. There are lower dosages, but I found, like, I started with 10 mg. It didn't work very good, so I just bought this from Amazon USA. It's over the counter. It's not something out of the blues. I'm not very sure if you can get this here in UK. In UK it's called jet lag medication. You need a doctor's prescription for it. I don't know, maybe not, I'm not sure. Okay, let us come to this medication. So this comes in smaller doses, 5 mg, 10 mg, small tablets. So what this does is it helps cognition in the patient. But every Alzheimer's or dementia patient is different. They have different, their brains are affected differently. So one medication might work for somebody, for the other person it might not work. But I know that whenever I experimented a lot, I would reduce the dosage, stop it, come back, and over years it took me to realize that this medication would help with cognition. All that confusion and storm in the brain of the patient, it will all settle down once they started taking this. But that was lower dosages. This is that medication, that clot busting blood thinner. So what happened is the patient would regularly be hospitalized, and it was assumed that the patient was having TIAs, that is known as transient ischemic attacks. It's sort of like maybe some sort of blood clot goes and blocks the brain and then moves on and opens that channel later on, so it's very difficult to catch it. So some doctor prescribed this for some reason, I don't know. I kept giving it, and the decline in the patient's health considerably reduced. So the patient was going through stepped declines. Every 3 months the patient's condition would drop down really bad. There would be significant events that would happen. I knew that the patient is going through some serious decline, and maybe the way the things were going, I assumed the patient would make it over a year. But after starting this medication, it's been like 2 years. The patient has stabilized. There isn't that significant decline that there is decline, but it isn't that significant anymore. So the patient is stable, no more runs to the emergency department, and it has helped a lot, at least. So I don't know, I don't have that research, but one of the main things I wish I knew at an earlier stage were these medications, quetiapine and melatonin to help sleep, the Delco-Ease and the Movacol sachets for constipation to help ease constipation, and this thing, the clot busting blood thinner. It's not a warfarin kind of thing. It is, I think, one of the most expensive prescription medication here in UK. I think one of the, not the most, but one of the most. So I hope this can help you understand some things about Alzheimer's and dementia and all. Alright then, if you have any questions, you can post down in the comments.